Eisenmenger syndrome can develop in all of the following situations except A. Tetralogy of Fallot, B. Aortopulmonary window, C. Truncus arteriosus, D. Ventricular septal defect. Correct answer A. Tetralogy of Fallot. Tetralogy of Fallot is a condition with decreased pulmonary blood flow, while all the other conditions are associated with increased pulmonary blood flow. Eisenmenger syndrome is by definition development of progressive pulmonary hypertension as a consequence of a persistently increased pulmonary blood flow. Hence, it cannot be considered in a low pulmonary blood flow situation like Tetralogy of Fallot. Adult survival is uncommon in all except A. Epstein's anomaly of tricuspid valve, B. Pulmonary atresia with intact ventricular septum, C. Transposition of great arteries, D. Interrupted aortic arch. Correct answer A. Epstein's anomaly of tricuspid valve. Epstein's anomaly of tricuspid valve is one condition with a wide variation in severity and clinical presentation. Survival to adult life is quite common, and so is detection for the first time in adult life. The septal and posterior leaflet of tricuspid valve are displaced distally in Epstein's anomaly, while the anterior tricuspid leaflet is quite large and produces the prominent tricuspid component of first heart sound known as sail sound on closure. The displacement causes a portion of the right ventricle to be atrialized. Oxygen step-up in the right ventricle is seen in A. Patent ductus arteriosus with pulmonary regurgitation, B. Rupture of sinus of Valsalva into left atrium, C. Sinus venosus atrial septal defect, D. Cort triatriatum. Correct answer A. PDA with PR. In PDA with PR, the oxygenated blood which reaches the pulmonary artery through the PDA from the aorta gets regurgitated into the right ventricle, producing an oxygen step-up in the right ventricle. Rupture of sinus of Valsalva can cause oxygen step-up in the right ventricle if the rupture is into the right ventricle and not the LA. Sinus venosus AST causes oxygen step-up at the high right atrial level where the defect is situated. The classical condition which causes an oxygen step-up in the right ventricle is a ventricular septal defect with left-right shunt. All of the following are revised Jones major criteria for the diagnosis of rheumatic fever except A. Erythema nodosum, B. Migratory polyarthritis, C. Sydenham's chorea, D. Subcutaneous nodules. Correct answer A. Erythema nodosum. Erythema nodosum is not considered as a major criteria for the diagnosis of rheumatic fever, while erythema marginatum is, though it is rarely seen. Sydenham's chorea is often a late manifestation of rheumatic fever, while arthritis occurs early in the course of the disease and they seldom occur together. Presence of subcutaneous nodules usually indicates the presence of associated rheumatic carditis as well. Median survival in a patient with severe aortic stenosis after development of heart failure without a corrective procedure is about A. 1 year, B. 2 years, C. 3 years, D. 5 years. Correct answer B. 2 years. Median survival in severe aortic stenosis after becoming symptomatic is thought to be 5 years with angina, 3 years with syncope, and 2 years with features of heart failure in the absence of a corrective procedure. Least lipid soluble beta blocker of the following is A. Metoprolol, B. Atenolol, C. Propranolol, D. Timolol. Correct answer B. Atenolol. Atenolol is a water-soluble beta blocker. In general, water-soluble beta blockers have renal excretion and need dose modification in renal failure, while lipid-soluble beta blockers have hepatic route of excretion. Lipid-soluble beta blockers cause the blood-brain barrier, while water-soluble ones do not. Beta adrenoceptor blocking drug with alpha blocking activity is A. Propranolol, B. Bisoprolol, C. Bucindolol, D. Atenolol. Correct answer C. Bucindolol. Propranolol is a non-cardioselective beta blocker with effects on both beta 1 and beta 2 receptors. Bisoprolol is a highly cardioselective beta blocker. Atenolol is also a cardioselective beta blocker. None of these have alpha blocking activity. Treatment for non-ST elevation myocardial infarction includes all of the following except A. Thrombolysis, B. Antiplatelet agents, C. Beta blockers, D. Anticoagulants. Correct answer A. Thrombolysis. All except thrombolysis are standard therapeutic approaches to NSTEMI. A white platelet plug which is non-obstructive is the usual mechanism for NSTEMI, for which thrombolysis has not been shown to be useful. Thrombolysis is the conventional form of treatment offered to ST elevation myocardial infarction, which is usually due to an occlusive red thrombus which can be lysed by thrombolytic agents. Currently, the best treatment which can be offered to STEMI is primary percutaneous intervention. Percutaneous coronary interventions can be considered in NSTEMI as well. For differentiating mitral restenosis after closed mitral valvotomy from unsuccessful valvotomy by the history, following feature is needed. A. Worsening of symptoms soon after valvotomy. B. Sustained improvement by at least one class in functional status for 1 month followed by worsening. C. Sustained improvement by 2 classes in functional status for at least 6 months followed by worsening. D. Sustained improvement by at least 1 class in functional status for 6 months followed by worsening. Correct answer C. Sustained improvement by 2 classes in functional status for at least 6 months followed by worsening. Sustained improvement in 2 functional classes for at least 6 months is needed to establish a successful closed mitral valvotomy by history. This is because of multiple reasons. After a major cardiac surgery, activities will be restricted initially and improvement in functional class as a result of surgery cannot be properly assessed. Even a small improvement in valve area will produce marked initial relief of symptoms for a person in functional class 3 or 4 due to critical mitral stenosis. Only when they return to normal activities will they feel the limitation in activity due to an inadequate valvotomy. Which of the following is not a manifestation of pulmonary venous hypertension on a chest X-ray? A. Redistribution, B. Cephalization, C. Annular sign, D. Prominent left atrial appendage. Correct answer D. Prominent left atrial appendage. Prominent left atrial appendage is a manifestation of left atrial enlargement. Pulmonary venous hypertension can occur with or without left atrial enlargement. When pulmonary venous hypertension is due to conditions like mitral stenosis, left atrium is also enlarged. But when pulmonary venous hypertension occurs due to situations like pulmonary veno-occlusive disease, left atrial enlargement does not occur. Annular sign, cephalization, and redistribution are the various names for the same phenomenon. Instead of the prominent vascularity in the lower zones in normal individuals, there is prominence of vascularity in the upper zones. Please don't forget to subscribe to this channel for future updates and click on the bell icon for all updates. Thank you.